Hey, hello everyone, welcome to this webinar. Today we are pleased to introduce you to the Digital Health Atlas. Everything is hearing me well, is it okay? Yeah, I think. Before beginning, I would like to thank AeHIN for organizing this webinar and for giving us the opportunity to present the Digital Health Atlas today. We truly appreciate to share this work and to engage with your community. So through this session, we will explore the key feature of the Digital Health Atlas, the benefits it offers, and its impact with a focus on Asia. And so I will start by introducing the Digital Health Atlas, that I will also say sometime DHA, and introduce the platform Implementome that hosts it. Then my colleague Sophie will present real-world use cases, and finally my colleague Mirana will walk through a demo of the Implementome platform with the Digital Health Atlas, so to give you an insight of all of what that is of how all of that is working. So the objective of this presentation is to show you how to use the platform and how it can be useful for you, and especially how and why would you register your own project into it. So I will begin by an introduction to the Digital Health Atlas and Implementome. To begin with, I'm not sure how many of you are already familiar with the Digital Health Atlas, like you can see in the screen. So before we dive in, let me ask you, how many of you have already used the Digital Health Atlas, like whether to search for a project or to register one? Maybe you can give your answer in the chat so we can see if like some of you are already used to it or not. Yes, you are. I see. Partially, yeah. Okay. Yeah, that's interesting. Okay, no, I think like yeah, there is a lot of no learn this first time. Yeah, nice. Yes, that's the objective. So let's enter partially. Okay. So let's enter in detail into that. And if you don't know it, like it's yes, nice. So to summarize the core of the Implementome project. So Implementome is a consortium of partners dedicated to making digital health implementation knowledge a public good. So it is co-created with the community and supports science-informed decision making and policy development in digital health. So since we work in the same thing with World Health Organization of the Digital Health Atlas, so the Digital Health Atlas has been integrated into Implementome. So that is a summary in this slide. So historically, the Digital Health Atlas here was developed by the World Health Organization as a global platform to centralize digital health projects. And starting from this foundation, in Implementome platform, you now have access to this new Digital Health Atlas. That is the World Health Organization Digital Health Atlas, but that has been redesigned. So it is the same project, including the same data, but with a different data model, target user, and some new data on it. So in a few minutes, my colleague Mirana will guide you through a live demo showing you how it works in practice. Our goal in Geneva Digital Health Hub is to build a science-informed and equitable future for digital health. So our mission is to support implementers, innovators, and decision makers by focusing on four key areas that we display here. So science, we want to provide science-based insights that are actionable, relevant. Communities, we aim to develop meaningful and efficient collaborations to empower digital health initiatives. Tools, we develop resources and tools for data analysis and knowledge management, so everyone can go into the data and implementation. So our objective is to create sustainable and long-term change by connecting implementation efforts and policymaking. In digital health, one of the main issues is the complexity of the existing landscape. So, in fact, the digital health ecosystem is expanding really rapidly. with a growing number of initiatives, research articles, guidelines, technology, etc. For example, here I display the map on the left that illustrates a multitude of factors that are involved in digital health. To go into that, I like to use the metaphor of the blind man and the elephant to illustrate the resultant key challenge in digital health that I just pinpoint. So this metaphor, just quickly, it tells the story of a group of blind men, each of them touching a different part of an elephant and drawing conclusion of what it might be based only on their perspective. So, for example, one feels the trunk and say it's a snake, another touches the leg and believes it's a tree, while another feels the tail and thinks it's a rope. In fact, this metaphor shows that they are all right, but at the same time, all wrong. And so the analogy I want to draw with digital health is that there are many initiatives that operate in silos that focus on individual aspects without seeing the whole picture. To make informed decision and drive impactful change, we must take a holistic approach, ensuring that digital health initiatives are understood in their entirety rather than in isolation. And so, starting from that, we can say that a major challenge in digital health is the lack of accessible and organized knowledge, which often leads to implementers working in isolation. And this results in duplicated efforts, inconsistent practices, misleading opportunities, difficulties in obtaining information from informed policymaking, etc. So the key questions that we address is then, how can we transform our implementation knowledge into a public knowledge that everyone can access? And a solution for that is Implementome with the digital health atlas in the Implementome. So the idea is to leverage data from project from digital health project to capture, organize, and use digital health implementation knowledge with the support of an AI assistant. So it aims to ensure that digital health knowledge is both accessible and actionable. So the process follows a progression from raw data that become information by entering into a data model, that become knowledge by being structured and organized. At what we work on with the platform, and the objective is to lead to insight that provide deeper understanding, to wisdom that informs better decision making, and ultimately impact in the real world. And yeah, so the Implementome, it's a project-driven community, and where it is the community knowledge, in fact, your knowledge, that contribute to the specialized AI assistant and from the digital health atlas that is filled by community project and you then. So this initiative, it has several key benefits. Like first, all projects are open access, and this for science is something very important for us. The platform provides visibility, offering increased global exposure. So if you put your project in the platform, that it aims at being more visible for people in the world. The information of project is up to date. Since it's directly the stakeholder of the project that manage it. With the platform, we provide data analysis tools, enabling better insights and decision making from the data of the project. So if you go into the platform, you will have access to this tool. And finally, we are developing an AI assistant that is going to be released soon, that aims at helping you going into the data, into the project, find precise information from all the projects that exist, and so help you understand the landscape of digital health. Okay. So finally, our group gdhub that exists since 2021 has consistently expanded as a global digital health community. We now have 10,000 members on LinkedIn, more than 100 members in the Implementome community that you can join if you want to share digital health with all these members. And over than 300 participants at the Global Digital Health Days, Geneva Digital Health Days last year, and the new session will be next 22 of May. Okay, so just to conclude briefly from this introduction, with the Digital Health Atlas and Implementome, we aim to bridge the gap between implementation and policy to make digital health knowledge a shared, accessible, and impactful resource for all and for you. And we invite you to get into that process with us. Thank you. And I'll give now the floor to Sophie to present use cases.
Perfect. Thank you very much, Alexis, for the introduction and the overview of what is the Digital Health Atlas and what is the Implementome. So my name is Sophie Delaigue. I work at gdhub in charge of communities, communities of practice, but also community building. And today I will present you 2 use cases that will really help you to get a concrete example on how the Digital Health Atlas can be useful for the community and for you on the role to map, to track, and to document digital health projects. So let's start with the first case. The first use case comes from Mali, Nepal, and Tanzania. We'll use those examples to see how the Digital Health Atlas can be useful for national mapping of digital health projects to improve coordination and visibility. So we start in Nepal. We have Nepal and Mali, but as we said, we will focus on Asia. I will start with Nepal. So we have long-term relation through research with Nepal. Nepal is a digital outpost of the gdhub, and we currently have a research study ongoing on gender study for telemedicine. And since all the years spent in Nepal, we have identified some challenges around, we don't just do the research, but of course, by integrating and understanding the ecosystem, we notice that there are really a lack of visibility of ongoing projects. When you discuss, this is maybe a feeling that you also have. In your own country, it's sometimes, and often this is what we hear, really difficult to know exactly what are the ongoing projects, what is the ecosystem exactly, who are the key stakeholders, who else is doing the same kind of projects that I'm working on, for many reasons. But one of them is the limited data sharing and documentation of projects. The second challenge is also this feeling, let's say, because it's not well documented, that there are many projects and many pilots. It's a fragmented ecosystem with small-scale projects and with poor coordination, and even now since COVID, there are a lot of projects that are also related to the private sector, which is good, but it's also increased this fragmented ecosystem where it's difficult to know who is doing what and where. So this is where the Digital Health Atlas can really help, being a centralized platform to structure the knowledge and to make it more accessible. And so we did this mapping exercise back to the early of gdhub, so in 2021. We did a mapping exercise in Nepal, but also in Mali, to provide more visibility into the digital health ecosystem. And the feedback we had were very positive, because it was exactly what I just described. A lot of people, they were so happy to discover a project that they didn't even know in their own country. So for example, in Nepal, they organized in 2022 this first digital health conference. So it was just an example of how mapping is a need and how mapping helps giving the visibility, and where the Digital Health Atlas is helping is that the result of this mapping has been entered in the Digital Health Atlas. So it's not just a conference And you can access the information from this mapping into the Digital Health Atlas, which is a publicly available platform, so anyone can access. And what is new also, so of course mapping are not new. What brings the Digital Health Atlas is the possibility to sustain and make sure that the information from the mapping is not lost. And also the second new aspect is, because I said that this conference was in 2022, so we just added the information from the mapping on the platform. But now what is new is that we redesign, so the Digital Health Atlas. The launch has been done at the Global Digital Health Forum in Nairobi last year. And now, because they realized, because it was WHO, it was of course in coordination with the ministry, and the ministry were entering the data, but we realized that the quality of the data, some aspects were missing, because you need to be in a project to really share insights. So according to the WHO and with a collaboration with them, the new Digital Health Atlas, the shift has been on who is entering the data. Of course, it's still in collaboration with the Ministry of Health, but the project owners, those who are running the project, are really the one who are the key target users to enter the data, to update the data. So this is new, and this has been launched a few months ago. This is a new paradigm, because why you would enter the data, why you would go on the platform, enter the data, what are your motivation, what are the benefits for you to do that? And this is what we really need to build with the project. And this is something that needs to be more dynamic. And this is where we started to work on communities of practice. Of course, for you, it makes sense because you're part of AeHIN, so you see the value of networks. But so we launched this Global Telehealth Community of Practice in partnerships with Village Reach, gdhub, and International Society. And there is also the World Health Organization through the GUIDE, the Global Initiative on Digital Health. Because what are communities of practice? Community of practice, you need to create value. So the aim of this project is to create 6 national community of practice around telehealth. So in 6 countries, we launch or leverage communities of practice. And how we do that? So we assess the country needs. Of course, there is an initial kickoff meeting to define the vision and the priorities. And what we see is that one of the key first activity that is, let's say, all the time, and is now something, the first activity we do, not because we want to do it, but because this is a request from the countries, from the stakeholders, is the mapping of projects, because it's the foundation, it's the basis of the coordination and collaboration. Because you need to know who else is here, so you need to do the mapping. So the mapping is one of the aspects, but why people engage in the mapping, it's because they have also opportunities to engage, to learn from each other, to connect, to share, to have different opportunities. So they are part of a network with activities and engagement. And this is what we are doing with the Global Telehealth Community of Practice. So the key message for me here with this first use case was that mapping, of course, are important, and this is why the Digital Health Atlas is here as a centralized platform to discuss about the process of the mapping. It's not just to register your project; it's go beyond that. It's registering, but to join opportunities, to join a network, and also to highlight the importance of communities, because communities of practice, they are here because they answer to a needs, and they offer opportunities, and they also sustain and support this aspect of mapping. It's just to translate how it is translate all this presentation on the platform. So you have it's an atlas, so you have a map. So for example, if we're interested in Mali, you can select the country. You see on the map, on the blue icon button, the number of projects, and on the side you have the list of the projects. So you can really, it's a website, or it's on the platform, navigating on the map, selecting the country, and have a quick and easy, accessible overview of the projects that are on the platform. And you have also, we will go, of course, deeper after in the presentation on the details of the project. So just to have a map with overview, and the second aspect is a country profile with data analytics. So for each country, you can see, for example, of course, it's based on the number of the project and or the information that is on the Digital Health Atlas. But you can see what are the key health focus area, what are the majority of services. So based on the project that are entered, you have easily accessible some analytics. But Mirana will show you more in details. And the second use case is just a quick story of one of our users, Dr. Jana, just to share how the Digital Health Atlas can really personally for all of you be beneficial. So Jana is a public health specialist and psychiatrist, and he registered his project on the Digital Health Atlas, but there are also many things that happen. So we initially met Dr. Jana on our community platform. I shared also the link in the chat. So the community platform is it's linked, of course, to the Digital Health Atlas. So he registered. He didn't register really. It was another users that shared podcast where Dr. Jana was interviewed. So this is how we discovered Dr. Jana. Then at the Global Digital Health Forum, we met Dr. Jana, and because we were here to launch the new Digital Health Atlas. So we went to the conference, and just after that, he registered his project. He was involved in mental health, a chatbot for mental health in Rwanda. So he registered his project on the Digital Health Atlas. You can see here, the name of the project is means Prepare for Better Tomorrow. So he registered, the project was not already on the database, so he asked to add his project, fill in the form, and you can see the different aspects. For now, it's kind of a page by project where you enter basic information like who is the target population, the number of beneficiaries, a summary of the project. And also what is really interesting is that you can add publication and you can really add insight and lesson learned. So this is really information that have a lot of value because it's really based on the experience of implementing a project. And on the side, on the right, you can see, you can add links to the project, who has created the page. So you can see his name. So you can contact for more details, for example, and you can see the number of views. So this is how it looks when you fill in the project information. But the story and the key message here is that we don't just ask you to give the information, to fill in a form. It goes beyond. Because after that, he was invited. We try to organize also, we have webinar series to highlight and to promote and to give visibility to those who are adding their project on the DHA. So he joined our bi-monthly event, Learn and Connect with Implementome, where project owners present. We have 2 projects by webinars, and then we have a networking session. So he joined one of them. We also had an event with partners, with Doctors Without Borders. It was a day to present. It was more internal, but external projects were invited, and they were looking for someone with mental health experience to present a project. So we said, okay, we just met someone that has a good project. So he was integrated to this day. And we also, for our annual conference in May, the Geneva Digital Health Day, we have included mental health. We'll have a panel, and he supported us to identify a key person to join the panel. So it's really like giving also, it's like on both sides, you register, you have opportunity. Of course, not everyone has all the opportunities, but it can happen, and it's really to show that it's got beyond register. He even had an opportunity for a job, and he also met someone else working in mental health in Rwanda, and they didn't know each other, so it was nice, the exchanges, and they shared with us this image. So just to say that Implementome is not just a platform and it's not here just to fill a form, it's to join a network and to get some contacts. And I just want to say thank you for Dr. Jana for agreeing to share his story with us today and to show the value of the Digital Health Atlas. Thank you very much. And I hand over to Mirana for the demo. Thank you.
Thank you very much, Sophie, for this very comprehensive use case and very nice example on what would be the added value of using this platform. Now, let's look at the platform and deep dive a bit better into its different functionalities. To support evidence-based decision-making and policy development, the Implementome has been designed to improve access to knowledge on digital health implementation. It aims to provide a comprehensive way to visualize data, offer multiple pathways to explore and navigate the information, and foster collaborative learning among stakeholders. The Implementome brings together a set of tools to help users learn from digital health implementation effort. So first we have the Digital Health Atlas, the main entry point, originally developed by WHO. It has been redesigned to offer deeper insight and to actively involve the project owner. Then we have the community platform, a space for digital health stakeholders to connect, share experiences, and engage in communities of practice. Then we have the AI assistant, an intelligent tool that delivers synthesized insight and recommendation, primarily based on our database of digital health projects. The science map, which is a visualization of tools that help users explore the landscape of scientific publication, and the evidence gap map, a new tool where we can identify areas where we need strong evidence, where evidence exists, where evidence is limited, and where further research is still needed on a specific digital health topics. Let's now take a closer look at the Digital Health Atlas section of the Implementome. There are several ways to explore the data depending on what you are looking for. You can navigate the interactive map and focus on a specific region, for example, Asia. You can use the search function to find topics or keywords of interest. You can apply filters to narrow down the result. For example, if you want to see all the projects in India, let's say, that uses diagnostics as a services and focus on maternal and child health, you can really specify what are the projects that you are looking for. Because high-quality data is essential for informed decision-making, we've introduced a data curation process. This highlights curated projects that meet specific quality criteria, such as having recent updates, providing key information like implementation insight, business models, and more. Then, when you open a specific project page, you will find key elements that Sophie presented earlier. These include general information about the project, details related to the implementation of the project, details about the economic and financial aspects. We can also see insight, as Sophie shared, and lessons learned, the source of data, and suggestions for similar or related projects. So far, this may seem like a typical registry or repository of digital health project. However, a major focus of this new Digital Health Atlas has been to streamline and improve the data entry process, making it easier, more structured, and more intelligent. For instance, when entering or editing data, users can automatically generate summaries based on the information they provide. We are also exploring additional features, such as automatically classifying the project based on their description, identifying similar existing projects, to reduce duplication and improving the overall consistency and data quality. In addition, projects can be submitted in any of the 8 supported languages, and they will be automatically translated when added to the platform. This will help improve accessibility and inclusion for global audiences. This focus on accessibility is especially important as the platform continues to grow. We now have over 1,200 projects in the platform, and this number is expected to increase. To help make sense of all this data and truly support decision-making, we've developed 2 tools, so the analytics and the AI assistant. The analytics go beyond individual project details to offer a deeper understanding of trends, patterns, and connection across projects. For example, users can view the country profiles that show which projects have been implemented in a specific country, let's say India, and with a key indicator such as the focus area, the services, the technologies, the funding sources. This concretely will allow government, donors, and decision makers to explore questions like what are the dominant focus areas for digital health in a given country, which tool and standard are being adopted, what are the current gaps or areas that need more attention. This insight would potentially help guide strategic planning, investment decisions, but also policy development. In a similar spirit of turning data into actionable and easy to understand insight, we are in the process of developing a digital health AI assistant, which will be officially launched in May this year during the Geneva Digital Health Day. In the AI assistant, users will be able to select their profile, whether they are researcher, implementer, policymaker, or another type of stakeholders, and ask any question related to digital health. The platform will then respond with a synthesized answer based on the data on our database and provide the relevant project sources for those who want to explore further. For example, if I ask a question like, can you provide example of project implemented in Asia and highlight which intervention were used, the assistant will return a concise summary and links to the corresponding project for deeper exploration. While analytics help identify key patterns and the AI assistant will simplify the access to the information, we also aim to go beyond just presenting the data and instead help users uncover the connections between them. Our goal is to move from information to insights. By analyzing the description and key elements of each project, the platform will be able to identify similar initiatives that will reveal opportunities to learn from related projects, connect with organizations working on similar challenges, and identify funders supporting similar areas. This kind of networked understanding will help users see beyond the obvious, facilitate smarter collaboration, avoid the duplication, and then amplify the impact. To conclude, and as a call to action, we want to encourage you, if you don't have an account yet, to create one and be part of this growing global community. Search for your project. If it's already listed, you can claim it and ask for the right to edit it. If the project doesn't exist yet, add your project and share your impact with the world. Engage with others and share your experiences, share your knowledges. Let's work together to make digital health knowledge a global public good. Your voice matters. Let's build it together. Thank you.
Thank you, Alexis, Sophie, and Mirana for sharing with us the Digital Health Atlas. It's very interesting. And then also I could see the transition of the Digital Health Atlas. I would say the avatar that existed a few years back and then what it is now. So to get the quick start, the discussion part of it, like I know some of the questions that I had in mind, like has already been answered to some extent in your presentations, the three of you. But still, like maybe to add more clarity, you mentioned about the primary intended users of this platform, but then is it like kind of like there's no restriction, right? It is just only the government, but it could be anybody, right?
Yes, yeah, thank you for this question. So the primary, you have different type of user. The primary user would be the implementer, so the one who are really implementing the project, because then he or she can find information about similar project that has already been implemented, if there are any tools existing that could be reused. Then we also have policymaker, because the idea for the analytics is really to inform policymaker about what is existing in the countries, what are the standards being used, if there are many telehealth projects, for example, should they create a specific regulation on telehealth? So it's also to inform the policymaker based on the implementation, the challenge that the implementers are facing. And then another user could also be the funders, because with the data that we have, the analytics that we have, and if every implementers share their knowledge and their data, we will be able to identify the gaps or where funders could invest their money, for example, to make sure that they really have an impact. So we have different type of user that could benefit from the platform.
Thank you, Mirana. I know submitting this kind of rich information or the collection, validation, periodic updates, maintenance of the platform over the years will take a lot of effort, both in terms of, I would say that human resources or also the financial resources, like especially at a time when digital health is going through also, I would say, challenging times right now around the world. How do you plan to manage this? What do you have a roadmap? Because, like, for example, if I am a project lead and I'm putting in the data into this platform, I would like this to remain for a longer time, right? And then I would like to see who exactly has access to this. And then is like at any point in time that I would like to sort of update, of course, I may have a handle to do that. But then if I want to withdraw, like I should have the means to do that. And then at the same time, anybody could actually key in the data, but then like, how do we actually validate the information that is available is actually correct? So that's another responsibility. But most, I would say that like, what exactly is the roadmap? The Digital Health Atlas is already there, but do you have a roadmap in mind? And then who exactly is actually funding this? Because how do we sustain this? Because sustainability in digital health programs is a very key topic right now. Also, as a network, like we have been debating this, and then this has been coming routinely. So I would like you to throw some light on this. What is the future roadmap like, or how it is, and then also how this initiative is funded, and then how this will be sustained. And then if somebody wants to actually withdraw the information that is already submitted, is there a way to do that? And then how do you ensure that the data that is already available is actually the correct information? Because sometimes somebody submits and then there could be, the project might have ended, it may not be functional anymore. I could see that like when it was updated, like a lot of other details are available. I really appreciate that, but how do we ensure the data is correct? And who actually validates that? Thank you.
Yeah, thank you for your question. Yeah, so this is a process we are building. For now, we when the data is entered, we validate it with the stakeholders, and we have a way to filter the data what that is complete and more accurate. But the question of long term is a real challenge, and yeah, our objective is to, when projects are entered into the platform, that there is a following of the project, so that we ensure that the data is up to date, and that also we ensure that it is also correct. So, but this is a part of the roadmap. This is still under development. Still, like we are the work we are doing for Implementome is developing the tool, all the elements to get into the data that we discussed during the presentation. The platform is still in a constant evolution since we get feedback and it gets evolving. Like we publish new release often, but yeah, the objective is to feed the platform with the project in digital health all around the world, and so to answer your question about the being sure of the quality of the project, like it depends of also the partner we have in the countries. And I see that Sophie raised her hand, so I let her complete.
Yeah, thank you, Alexis. Just to complete, and you're right, Jay, it's the key challenge, like how to maintain, how to add more data, and how to have quality data. So this is really the key challenge. The answer has been included in the redesign, like to really include the project and what's the roadmap and what's the strategy to do that. It's really to create the value for the users. So it's not per se that you receive the reminder, you have to complete the information, but you don't know why, or this is just something you have to do or you will miss. So it's really to create links, and we use Agile method to really, because we are in touch with the users. So because we need to present, as we are doing today, we are doing follow-up. So we really try to see what are the value for them. And because it's Agile, all the value has not yet been identified, but this is the key answer. The other answer is also to put resources on our side and with partners to ensure that projects are validated, that there is quality data, because it's as for any AI solution, because the objective will also to develop and give something accessible to all, to have an AI assistant. But for that, you need to have quality data. So it's really resources from us and from partners and the value for the users and understand how they would benefit from it.
Thank you, Sophie and Alexis, for your clarifications. And then, I think we have a lot of people joining from other networks, our peer networks, also UN agencies, and then also the Ministries of Health, and then Academy, and many others. Let's take some questions from the floor. I'm seeing some questions already in the Q&A box, and then there is one, and then there are a lot more in the chat. Cha, could you actually read out those questions for the speakers?
I think someone would like to ask a question through the microphone. Dr. Sohela?
Yes, thank you so much for a really insightful discussion, and thank you for the opportunity of asking a question. I'm Sohela. I'm a neuroscientist and a digital health expert. I work out of India. My question largely is focused on you're building this fantastic repository, and you showed us how we can do data analytics and see countrywide data. I would really like to understand, how do we ensure interoperability of data variables within the various different projects that are coming? Do you follow frameworks such as DAKS by the WHO, which is your, digital adaptation kits, or do you follow the FHIR standards? Because, the way I would express my data could be very different from the way you, represent your data. So just to make sure that there is interoperability of data and then there is comprehensive visualization across, larger areas, how do you guys do that? I would like to know more. Thank you.
Thank you for the question. Maybe I can provide the first set of answer. So we really refound the data model earlier last year to make sure that the way of describing the project would be the most easiest for the people. For now, we have this data model based on project implementation, but one thing that is on our roadmap is also to describe specifically, for example, tools because users were also interested to have more information about tools that could be reused, for example, and this could be described differently than we described the project implementation. So for now, we focus specifically on project implementation as an initial start, which is based on the previous Digital Health Atlas, but has been improved. And in the next step, we'll focus more on other specific components, like, for example, tools or other items that may be more linked to research, like publications or this kind of insights and information. The end goal would be really to create this ontology of digital health, because as Alexis said in the beginning, we see all the elephants differently. As a researcher, I may be describing digital health differently than someone working at the hospital, a doctor, for example, or someone working at the ministry. And in the process of developing this platform, in parallel, we are also working with data scientists to really build an evolutive ontology that could be adapted as well to the different type of stakeholders. So this could maybe answer as well your question.
Thank you, Mirana. We have about 5 minutes to go, but then I think we do have other questions. I do see one in the Q&A box. That's from Osman. On Digital Health Atlas, do you promote open data? I mean, is it possible for community to access free, anonymous, real data?
Regarding the open access data, it is a feature that is going to come soon, to be able to download some data in a Excel file. So you will be able soon to select what you need and then download it in a usable way to do your any kind of work you need from that. And so this is under development and will arrive soon. I don't know if it answers the question.
Maybe if there are any other questions, Cha, maybe we are reaching the top of the hour.
Yes, Sir Jai, maybe we can have this last question from Dr. Dipesh Kadha. So how do you see AI and machine learning shaping the future of this platform?
So now we are starting to integrate the AI to really facilitate data entry. So the first is really on the data entry part, because we know that it takes a lot of time to enter all information related to the project. So we use AI to facilitate the entry of the data and to structure better the data, because sometimes in the previous Digital Health Atlas, we have a project description which are really long like this, and sometimes it's just like 3 sentences. And we thought that using AI will help really structure data with key elements that we think would help the implementer to take decisions. On the other side, on the way to navigate through the data or better understand the data, so we are starting to integrate this AI assistant that will be launched soon, and we are really going to work on data analytics to see the links that I say that may not be obvious, but that could help build future collaboration or build future projects that really may have an impact on the health of the population. So the idea is to work more on data analytics and facilitate the entry and the navigation through the information using AI.
Thank you, Mirana. One quick question from me. I know that this same team also worked on iCheck Digital Health for the guidelines and checklists for reporting the digital health interventions, right? So is there any, as part of the data collection or submission of the projects itself, have you built in something with iCheck?
Yes.
Yeah.
The idea of the iCheck, because it has built in a structured way to really give insight on the implementation, because we wanted to give more opportunity for implementers to share their experience. So the iCheck, the different variables that we collect in the iCheck guidelines is really towards more sharing about the implementation experience. And once we have enough publication based on this iCheck guideline, the idea is also to use it in our database and to use it by the AI assistant to be able to answer the questions on challenges, insights that we could derive from this publication.
Thank you, Mirana. I hand over the floor back to Cha for any announcements and then also the wrap up with the group photograph. Any final words from the other speakers here? Sophie, Alexis, you have anything to share quickly within 30 seconds as we conclude?
Maybe just to say that in case you face any issues, you struggle with the platform, don't hesitate. We leave our contact in the chat. So we really try to do our best to make it very user-friendly and to really assist you at any step of the process. Thank you, Jane.
Thank you, Sophie. That's, I think, very helpful for anyone who would like to actually submit, and if they face any issues, that they could contact you. If there are no other things, and then I think we have also reached the top of the hour. It has been very exciting, and really thank the gdhub team for being with us and then also sharing. And especially, I like the case studies. It was very helpful. And then I think it's a beginning. I'm sure that we will have more opportunities to share as this platform also evolves. And then, of course, there are other questions and then any other feedback that we receive, we will also pass it on to you for response.
Thank you, everyone.
Thank you. Thanks for being with us. See you in the next hour. Bye.
Thank you.
Bye-bye.
Thank you.
Bye.
Thank you.
Thank you.
Bye-bye.
Bye.